So when I first joined Catalasso Clinic, my expectation was that I would see many patients from the city, and perhaps a fairly large percentage of them being people who aren't working or haven't been taking care of themselves or have problems with excessive drinking and that type of thing. And I was also expecting a lot of drug-seeking behavior, which is not just occurring in clinics, but certainly occurs in private practice. And I'm happy to say that really the clientele that we have here are patients who come in from a background of working, or they are seeking a job and need medical care, either for a physical, something as simple as that, so they can go to work, or because they've developed problems that need attention. And that's something that wasn't really easily available in the past. The other alternatives to people in the city are to go to clinics within the hospitals. And although those have been available for years, it is often difficult to make an appointment. It takes time. The hospitals are further away from the center of the city. The thing that's unique about the Catalasso Clinic, it is first and foremost a place that we call faith-based. And we want to portray Jesus Christ wherever we go. Having a clinic is no different from having a prayer tent or having other opportunities to show the love of Christ. It's certainly an attractive way of doing it because people need health care. And obviously we're not charging anything, and we're not expecting anything from patients. They come here because they have medical problems. And if we can take care of the medical problem, that's great. But much more important is that we show them the love of Christ. And that's what this clinic was based on to begin with. So it's something we try not to lose track of when we're doing our medical care. The opportunity to give care to people in the city is an opportunity to make things available that aren't available to people at other places. And because of the generosity of the community, including the hospitals, we're able to arrange medical testing, we're able to obtain low-cost medications, and make available things that otherwise wouldn't be possible. We have specialists in many different areas who have given their time so that patients can get not just primary care, which is most important, but they can also get referrals for things that are needed that can't be done directly through the clinic. I saw this patient who had actually been here several times in the past and had medical tests that suggested she had a chronic underlying disease that would eventually need treatment or would be a high probability of progressing and become very serious. Fortunately, she really wasn't terribly unhealthy when I saw her, but the fact that she had this disease that had been diagnosed a couple of years previously made it a time to really think about what we could do with this. And it happened to be a disease that's in my field of specialty. And we were able to not only fine-tune the diagnosis because of the testing that's available, which even the testing is very expensive otherwise, but this was made available to her at no charge. But also to provide a route to find treatment. The treatment for this particular condition is very effective, and it's a major breakthrough in medicine. But like so many breakthroughs, it has a very high cost. And the cost of that treatment is up to $100,000 for a 2 to 3 month treatment that is almost 100% effective. And there's nothing close to it. There had been nothing like that in the past. It's only been available for a few years. And this would not have been possible for her to obtain. But because of connections that this clinic has with the pharmaceutical industry and with people that are willing to help, we were able to not only get the testing confirmed, but also to get the medication for her, and made it possible for complete treatment at very little cost, if any. If we were not able to provide care through the Catalasso Clinic, it would be very unlikely that she would have been able to find treatment for this condition. Not only because of the need for diagnosis, which requires further testing and going to a specialist and the expense of all those tests, but also because of the expense of the medication itself. Unfortunately, we're not able to provide this type of care for everything, but for a large number of things, we've been able to find avenues of treatment, very different in terms of where the funding comes from or where the medications come from, that make it possible to provide medications that would in no way be available otherwise. So without Catalasso Clinic, a patient like this would have gone on to progressive damage, maybe long-term chronic damage that couldn't be repaired, and even die from this condition.